So this is going to be a pretty brief show and tell, just highlighting some of the key features on the website. And we thought we would just use examples showing some of our chronic disease related data that's available on Healthy NEO. So first I thought I would show you how to go about searching for data on the website, and just know that there's a couple ways you can do this, including on the homepage, this search bar. But one thing I wanted to point out, if you go to the Explore Data tab and then Indicator List by Location, this is a really good place to start, especially if you are a newer user to the website or you're looking for data on a particular topic. So this Indicator List by Location shows all of the indicators that are available on the website and at what geographic levels are available. You can see to the right here. So these are organized by topic and subtopic. So I'll just scroll a little bit to give you a sense what this page looks like. It's pretty long, so I'm not going to bore you with that. But again, say you were looking for data related to cancer, this would be a good place to look just to see what indicators we have. And again, if you're looking at that data or looking for that data at a specific geographic level. And you can click on these indicators if you want to dig a little bit deeper. But as Libby shared, we do have 275 health and quality of life indicators, and those come from about 30 or so sources. So that includes a variety of state, national, and other sources. And most of the data on the site is curated and maintained by our vendor, Conduent HCI. There is some local data that we have added that we do manage. And again, the site has data for the 8 counties in our current project region, as well as the municipalities, zip codes, and census tracts that make up those counties. And just keep in mind the availability of data on the site really just depends on the source that it's coming from. So a second way I wanted to show you how to search for data is again under the Explore Data tab, then search for data. So here you can do a keyword search. You can also use a drop-down to look for a specific indicator, and then this drop-down to look by specific location. So for the sake of example, I'm just going to go ahead and do a keyword search for cancer. And then you would go ahead and just click on, and you'll see a list here of all of the indicators related to cancer that are available on the website. And then if you want to learn more about a specific indicator, again, you could just click on one. So I'll do age-adjusted death rate due to cancer. So once you click on an indicator, the website is going to prompt you to select a location. So you can either select county, and that'll take you to a page looking at all of the available counties in the region, or you can select a specific location. So I'll just go ahead and select Ashland County. And sorry, my internet's running just a little slow here. Okay, so now we are looking at what is called the indicator detail page. So this is where you will see the name of the indicator, the location you selected, as well as the measurement period that is being shown, and you can select prior measurement periods using this drop-down. You're going to see some text about what the indicator is, as well as some text about why that indicator is important. And then just below that, you're going to see the current value for the location that you selected, as well as information on the source, who maintains the data, and when it was last updated. And you'll see when you're on the website, it does use a variety of gauges and dials to compare and trend data, as well as different color coding options. So to the right over here, you're going to see any available comparisons that we can take a look at. So looking at Ashland County compared to other counties in Ohio, across the US, comparing Ashland County to the state and US value, for example. And if you do hover over these, you can see this box will pop up just to give a little bit more information on how to interpret that. And then we also have a legend option. So on the left, if you click see the legend, this can also be a helpful tool to look at. So you're going to see a table here showing, or a graph here showing trend over time data. And then it looks like for this particular indicator, we do have breakout data available by gender. So any of these graphs on the website can be downloaded just by clicking this 3-bar symbol at the top right corner. So just keep that in mind. And then there's also going to be a map available for this location that can be customized if you want to, add labels, change the background, etc. And these maps can also be downloaded. And then at the very bottom of the screen, there's going to be a table. So this is showing the values for all of the counties in our region that are available. And you can download indicator data at the very bottom right here by just clicking download county indicator, and that'll download it to a CSV file for you. So again, that was just very quick walking you through how to search for data on the website. We do have several specialty dashboards, and just for the sake of time, I'm not going to show you these, but I just thought I would quickly mention them. And so the first is the demographics dashboard. This contains 250 demographic variables available at the state, county, and zip code levels. And this dashboard allows you to view and download maps and other visualizations for individual demographic variables. We have a disparities dashboard. So this allows you to view indicators that have subgroup data available by race, ethnicity, age, and gender. And you can just look at how those values differ among subgroups and looking at how subgroups might compare to an overall value for the population. This is a little bit newer, but we do have a food insecurity index. So this is a tool that was created by our vendor Conduent HCI, and it's a measure of food accessibility that's calculated using social and economic factors that may impact a household's ability to purchase food, and it can be used to identify areas in your community that are estimated to have the highest food insecurity. We also have a Healthy People 2030 progress tracker, and this shows how a location compares to the National Healthy People 2030 10-year objectives for improving the health of all Americans. And then lastly, we have a Socio Needs Index. This is another tool that was created by Conduent HCI that summarizes multiple socioeconomic indicators such as poverty and education into one score for easier identification of under-resourced areas. And that's available by county, zip code, or census tract. That covers our specialty dashboard just in a nutshell, but feel free the next time you're on the website to check those out in a little bit more detail. So there are two data-related tools on the website that I wanted to show you in our time together. So the first one is a custom dashboard. So I'll walk you through how to create one of these on the website. And these dashboards allow you to see a summary of the indicator and then any comparisons for your community, for example, to other locations, national benchmarks, looking at that data over time. And keep in mind that these dashboards are dynamic. So as the data is updated on the website, your dashboard will also automatically be updated, which is really nice. And you can share these with partners, and you can use them to assist with reports or presentations, for example, that you might be working on. So I thought I would just show you an example of a custom dashboard that I created. So this includes some heart disease related indicators for Lorain County. So as you can see here, these are the indicators that are included in my dashboard. And then you're going to see this column is showing the current value for Lorain County, and then to the right are all of those comparisons that are available. So again, you can look to see how is Lorain County faring against the state or the country. What's that trend over time looking like? And again, also comparing to other counties across the state and country. So I'll scroll up. So there's two ways you can build a custom dashboard. There's the filter indicator option as well as a handpick indicator option. So I used the filter indicator option because it allows you to select by topic area, which is just quick and easy for the sake of example. The handpick indicator option you would filter to here. That's better if you have specific indicators in mind that you want to select. So here you can see I've just selected a location, and again, this is just a drop down. It's very easy. I've selected a topic, and you can select multiple ones. You can also filter by populations, classifications, comparisons, subgroups, etc. So once you make those selections, you would just click search, and then your custom dashboard will be shown. And there's two ways to view these dashboards as well. So we're looking at it right now on the list view, which is to me more of like a standard, row look. Just below search results, there's this kind of stacked box icon. So if you click on that, that's showing these indicators in a card view. And what's nice about the cards is you can download individual cards. And those are nice, maybe to pop into like a PowerPoint slide. And then as I mentioned, these dashboards can be shared with others. So if you click save a link to this search, you'll get a URL that you can then copy and send in an email or even embed into a document. So that is one of the data related tools I wanted to show. The second one that I wanted to show is the option to build a custom report on the website. So we have a tool called the Location Report Builder, and this allows you to build customized reports based on indicators in a location of interest. And it's a really easy way to pull together different components on the site into a downloadable PDF. So you can use these reports to tell the story of your community, and these can also obviously be shared with others because you can export them as a PDF file. And one thing I did want to point out, unlike the custom dashboards, these reports are a snapshot in time. So if the data on the site is updated, that's not going to transition over to your report. So just to keep that in mind. And you can use these reports to create things like a community profile, like we've used them to create demographic profiles. You could highlight a specific topic or maybe even a priority. So this is an example that I created using diabetes-related indicators specific to Portage County. So you can see that I just included 2 indicators here, again, just to keep it simple for time's sake. But so I've got adults 20 plus with diabetes. So you can see up here, there's that indicator card. So it's showing the value as well as any available comparisons. I've included some text about the indicator as well as the source, and then a few graphs. And I'll scroll down so you can see. But again, you can customize these. You can make it look however you want. If you wanted to create your own report, you would just go to Tools and Resources and then build a custom report. So first, you're going to have to select a location. And then once you've selected your location, this toolbar is going to show. So you would add indicators by clicking indicators. So I'll just go ahead and type in diabetes real quick. And then all the related indicators would be that are available would show on the left. You would just click on an indicator, and then you can select the various components that you want to add to your report. And once they're in your report, you can drag and drop, resize, even delete if you accidentally added something. In addition to indicators, you can also add demographics data, socio-needs index data, a map of the location you selected, a legend, custom text, and then these horizontal or vertical lines if you want to use those just to break up your content. So again, I know that was very brief. As you're using the website, if you do have questions, please don't hesitate to reach out to Libby or I, and we'd be more than happy to assist. So I'm going to go ahead and I'm going to stop sharing. And Libby's going to pull up our slides again, and then we're going to turn it over to Jillian Cremona from Lorain County Public Health, who we're really excited to have. And she's going to be sharing about chronic disease efforts in Lorain County. So let me just, oh, perfect. Thank you, Libby. So take it away, Jillian.
Hi, thank you. Yeah, this is fun to be here and to be able to talk about our work. So like they said, I'm Jillian Cremona. I work for Lorain County Public Health. So I'm here to talk to you a little bit today about some of the work we do around chronic disease prevention in Lorain County. That's a picture of me to kick it off with my dog. So you can move on to the next slide. And then this is our title tagline slide, picture of Lorain County there. So next slide, we can get started. So I did want to start off with, I think most people on this webinar are familiar with a CHA and a CHIP County Health Improvement Plan and priorities. So I just wanted to show ours. Chronic disease obviously is one of those. Chronic disease and cancer are both 2 of our leading causes of death in Lorain County. So these are some of our priorities and how they work in here. Go to the next slide. Okay, so trends, more specifically that we're watching, particularly around heart disease. This looks at the 35 to 54 population, and we like looking at this population for 2 reasons. One, we want to start with more of the upstream younger age preventative work. That's the role that we have. And then also, this is a group that's notoriously hard to reach. They're busy, they're raising children, they're helping aging parents, and they're working. So it definitely requires a little bit more focus. So you can see we in Lorain County do a little bit better than the state, but that gap is closing and not in a good way. So that's why we continue this work and a trend that we watch locally. You can move to the next slide. Okay, so some of the ways that we work on this, when I say we, I say really the entire health department, but my division is health promotion, chronic disease prevention. There's a whole team of us that do this work, so it's not just myself. Some of our local efforts around policy, we like doing a lot of this policy work. I kind of kicked off with it, but it really is the backbone kind of sustainability piece of really getting some of this work, ingrained in more longevity in policy. So we've done a lot of work in the last number of years around tobacco-free policies, updating those particularly in schools and parks and public spaces. We also work a lot on shared use policies, particularly with the schools. That's that picture at the bottom is indoor walking. In non-COVID times, we have indoor walking available at many of our schools in the county. It's a fun and safe opportunity to allow people to access physical activity, particularly in the snowy months when it might be icy or cold or dark outside. And then some of the other ones we work on, healthy vending and healthy rewards policies. We really like to move this idea away as, food is not a reward or a punishment, we're rather neutral. So let's look at other ways that we can celebrate, particularly when children are involved. Next slide. All right, so a more systemic view. This is some of the more complex things that we work on and some of my favorite pieces. So I personally do a lot of work with healthcare providers and outreach and access to care on those pieces listed there. The example in the picture, these are our blood pressure cuff kits that are available at every single library in Lorain County except for one. And they are able to be checked out just like you would check out a book. So a circulation period of 2 to 3 weeks, depending. Our libraries are great partners on this, and this actually came out of work with providers saying, I tell people to check their blood pressure, but no one does it. So we were kind of looking at how we could assist there, and whether or not it's someone can't afford a blood pressure cuff, or they might be that younger group that we talked about earlier that just isn't personally ready to commit to buying a blood pressure cuff themselves yet. Here's an option to borrow one. Not pictured in here in the kits, there's also information on how to correctly check your blood pressure in English and Spanish, as well as little cards to record your readings, information on classes available, healthcare providers in the area. These are really well circulated. Some of our libraries, the Lorain main branch has, I believe, 6 or 8 kits these days because they kept requesting more, as that they were always checked out and there was a wait list. So this is one of my favorite things that I've worked on in the last couple of years. You can go to the next slide. All right, so we also like to do a lot of environmental, more built environment changes. So while we do a lot of works around, regional planning with NOACA and things like bike lanes, we also do projects that are pictured here. These are great because they're really sustainable changes, to the environment. Pictured here, we do a lot of work around smaller grants that allow for enhancements of multipurpose trails and hike and bike trails, like you see pictured. And then also one of our collaboratives recently funded the buttons on this crosswalk that you see here with the nice flashing lights, solar powered buttons that allows that to be available for pedestrians. We'll talk about this a little bit in the next slide as well, but this is nice because it came out of other partnership. On this side of the sidewalk that you're standing on is the library, and across the street is the park. This is in North Ridgeville. And this is nice because it came out of a number of pieces that the library and the parks were working on together, and they determined that there was a need to enhance the safety of the crosswalk. So we were able to get that funded and in. So another cool thing we've been working on. You can go to the next slide. Perfect. All right, so how does this work happen? Much of this work happens through collective impact and collaboration of partners. So most of the things I've talked about and the ones that are pictured here, these really are complex problems that, aren't easy for a single person to solve on their own, or they would have been solved already. So much of the work that we work on happens in these community collaboratives. The logos are at the bottom. They're just a couple of them. A number of them are funded by the Greater Lorain County United Way, and a number of them are also funded more traditionally out of State Department of Health, Department of Transportation, that sort of thing. But really what the aim of these is the funded collaboratives get together with partners who really decide what's best for either their location or their topic, depending on what the needs are. So pictured here are bike shares. A number of our Libraries offer bike shares, just like those blood pressure cuffs kits. You can check out a bike at a number of the locations throughout the county. In some areas of the county, these are for fun and for recreation and bike tours of the local parks. And in other areas of the county, people use these in what we think of as more of a practical sense, either grocery shopping or going to a job interview. So they're used pretty widely. The middle picture is signage and people participating on a dietitian-led grocery store tour. These were support of a diabetes prevention class project. So they got to go on a tour of a local grocery store with a dietitian and pick out healthy options that worked for them. And then the last picture is a story walk or storybook stroll. These have gotten a bunch of attention in the last couple months because DeWine did a big ribbon cutting, but we've been putting these in Lorain County for years at this point. They're throughout the county. They really require many partners to come to the table, the library to provide the books, the parks department to provide the extra manpower to mow and maintain around the facilities, and then obviously the funding behind them. These are great. We love them because they promote literacy, they promote positive family interaction with children, and obviously healthy activity walking outside. You can go to the next slide. All right, so some of our emerging work and what's coming for us. We recently did a needs assessment and listening sessions and interviews in the county around particularly women's health. I won't read those barriers listed, but these were some needs that were identified as we were learning about what barriers to women's health, particularly in Lorain County, are. None of those will be a surprise. You can read through those. And some of our planned work and where we're going. Some more work around access to care, so both healthcare navigation once someone is in the healthcare system, but then even basic access of how do you get to a provider, how do you find a provider who meets your needs. And then we're also going to do some work around workforce development, so kind of a new direction and emerging efforts, particularly around that middle bullet point of paid time off for sick time or flexible work schedules for accessing provider on your own time or for any dependents you may have. Next slide. And that's my wrap-up slide. There we go. So this is my contact information, my direct line, and my email address if you want to hear more about any of that. I will.
Thank you, Jillian. Yes, thank you so much. That was so great to hear. And I know that we are close to time, but I took a couple of notes of things that really stuck out to me. But that idea of the blood pressure cuffs that you have at the libraries, that to me is such a great representation of partnership and how different entities can work together to close these gaps. You have your provider saying, we need people to check their blood pressure, but they don't have access to one. And here you have this great resource. And that was something that definitely, I just find that to be so impactful. So I'm going to go ahead and pull up the remaining of our slides, and we will go ahead and look at the chat. Sarah, are you seeing anything come through the chat right now? And I'm going to pull it up on my end.
No, just a comment that they loved that idea with the library partnership.
Yeah, I know. And since I know we are just about out of time, but I do have one quick question for you, Jillian. Has COVID impacted the way that you guys have been delivering any of your chronic disease programs? And if it has, what are some of those success stories that you've been seeing? Are you reaching different populations? Have you been able to open up a new avenue for promoting certain activities and ideas? So that was one of the questions that I just kind of had at the top of mind.
Yeah, no, it's like the ongoing challenge for quite literally everyone in the world right now. I think it's allowed us to explore some new digital formats. We have an entire platform in Lorain County called United We Sweat that offers free fitness opportunities throughout the county. And it's something that has been offered in a small number virtually before the pandemic, but that's something I know that group is really looking at and has been looking at, how do we support people exercising in their home, maybe through a fitness-led provider, that sort of work. So definitely moving to the digital world like many people are. And some of it, some of these things do have to be on pause, much like the indoor walking. Most places didn't offer that last year, but are excited to get that rolling again this year and moving forward and moving to outside, all of the things we all know so well at this point.
That's great. Thank you, Jillian. Since there are no other questions, I'm going to go ahead and move into our wrap up. Thank you, everybody, for participating. Thank you again to Jillian for being with us today. Here is my contact information as well as Sarah's contact information. We are very reachable by email, and you can also reach us through the Contact Us feature of the site. If you have questions about chronic disease, I know that we have all of our counties that are in the region that have chronic disease listed as a priority in their CHIP. So we definitely want to be sure that we're being responsive to the needs of all of you. And with that being said, we hope you will consider joining us for parts 2 and 3 coming up in November and December. We will have a guest speaker from the Cuyahoga County Board of Health on November 2nd, and then we will have a speaker from Case Western Reserve University for the session that's on the 14th in December. So we hope you will consider joining us. Information to register for that is available through healthyneo.org. And with that being said, that is the conclusion of our webinar. So thank you again, and we hope you all have a great day.
Thank you.
Thanks.